In the medical world, a patient cured is a customer loss. In 2013, I was wrongly diagnosed with pancreatic cancer. I was like, oh no, I'm so young and is it real? I'm supposed to undergo this operation? Brother, are you sure this is a cancer? So on paper, yes, your blood sugar is well controlled and yeah, of course it's true. But deep down, the patient is getting worse. That's why they still suffer from complications. For me, we need to make money the right way. And the right way is truly to help patients.
Welcome to the No Sweet Talks podcast,
where we share with you the ugly truths about diabetes most doctors won't tell you.
I am your host, Ian, and today this is our second episode, and we're very glad to have Dr. Andrew from Clinic Zero.
Yes, thank you so much, Ian, for having me.
All right, so first of all, congratulations on your recent publication on IJO, International Journal of Obesity. Tell us how you feel about it and tell us more about it.
Of course, we are really excited about this publication because in a way it is a proof that our work is now validated by medical industry.
Mm-hmm.
So we've been working with Manipal University College Malaysia for past few years, and now finally the paper is now published, and the exact date of the publication was actually on the 23rd of July 2025. So it's indeed fresh from the oven. And the conclusion that we've gotten so far, based on the study, is that the time-restricted feeding with the low-carb diet demonstrated significant improvement in BMI, our body mass index, that means our body weight, the fasting blood sugar, the HbA1c, the triglycerides, and the HDL. So combining time-restricted feeding and low-carb diet could lead to better individual diabetic management. This was the conclusion that is published in this International Journal of Obesity.
So how many years already you mentioned just now?
For the past 2 to 3 years. So this is actually a retrospective study because under Clinic Zero, we do have about 2,000 plus patients. And what the college has done is they extracted about 1,000 of our patients, their data, and then they did this study, they did this analysis for our patients.
So must be a lot of work for your side as well.
Yes, of course. The patients they are obviously our patients, but there's also a lot of work on Manipal side. Yeah, because we need somebody to extract the data. We need somebody to do the analysis. We need a statistician for it. So there's a lot of technical details which I'm not an expert in. Yeah, right. Yeah, so it's actually a teamwork. It's truly a teamwork, and I want to really thank you, Manipal University College Malaysia, for giving us an opportunity to publish such a meaningful paper.
So it's also, I believe, to the patients also, they will have more confidence in trying out, the treatment.
Yes, obviously.
Yeah. So Dr. Andrew, I want to ask you, when it comes to reversing diabetes, right? Why most other doctors they can't reverse diabetes?
Ian, if I were to ask you, most doctors, they play with the symptoms rather than they treat the root cause. What is your point of view on this? Do you agree with me?
Yeah, I believe so.
Yeah, many a times is that way, right? And I think they are really not to be blamed, but because the system is that way. Yeah. So for me, I am very into the root cause. And the reason is because 12 years ago, in 2013, I was wrongly diagnosed with pancreatic cancer. So they found a growth as big as a ping pong ball seated at the head of my pancreas. And without finding out the root cause, they wanted to operate on me. Yeah, so they offered me an operation called the Whipper's procedure, whereby they are supposed to remove part of my stomach, part of my pancreas, and the first part of my duodenum, the small intestine, of course, together with the growth. So at that point of time, I was already a practicing doctor, and I was like, oh no, I'm so young, and is it real? I'm supposed to undergo this operation? So I asked the attending surgeon a question. I said, brother, because he was actually my friend. I was like, brother, are you sure this is a cancer?
Are you sure this is a cancer?
It seems like he was stunned by my question and he couldn't answer me at that point of time. So I told him, I said, I want to find out the root cause before your knife actually touched me. So thank goodness I insisted, and therefore I was then referred to another hospital, and then some procedure was done on me. They basically did a scope on me. So they inserted a camera via a tube through my mouth, went all the way in, and then they took out some sample to check. And they finally realized that it was not cancer.
Wow. So how many days are from the time you were diagnosed until the point where you get, the truth?
I would say approximately a month. And obviously I was very nervous. I was very anxious. The truth is, if it's really a pancreatic cancer, we know that the prognosis of pancreatic cancer is very low, like it's 5%. That means every 100 patients who are diagnosed with it, only 5 survive in the end.
In fact, Steve Jobs also suffered from the same.
Exactly.
Yeah, thing.
Yes. So can you imagine Steve Jobs also succumbed to it, and who am I, to actually survive this? Yeah, so obviously I was very anxious, but thank goodness, in the end they realized that, wow, this is just a tuberculosis infection. So it was infection. It was not even a tumor. So it was not a benign tumor. It was not a malignant tumor. It was just an infection. Just like an abscess, like a pimple on our face. Just that this is a bit bigger, and this is situated in my abdomen at the head of the pancreas.
Do you think if you were not a doctor, you would have said, okay, let's do the operation, let's go on with it, and not question whether it is true or not?
Yeah, I think if I'm not a doctor, I would probably proceeded with the operation. Yeah, so because the two words, this pancreatic cancer is rather scary, right? Yeah, and we wouldn't want any delay of having this in our body. Anyway, I thank God for this experience, because it was because of this, it changed my perspective. And I became very insistent about looking for the root cause whenever I see a patient. And well, that's how I started my practice of Clinic Zero. Yeah, where whatever we do, especially when it comes to diabetes, want to treat the root cause of it and not play with the symptom.
What do you mean by playing with symptoms? Can you elaborate a little bit more?
Okay, one simple example would be, let's say you have a sore throat now.
Sore throat, okay.
Upon checking, we realize that you're actually having a bacterial infection. Okay, we know most of the time it's a viral infection, but it can also be bacterial. So let's say we realize that you are suffering from bacterial infection of the throat. However, I insist to just give you some Panadol, some paracetamol to just bring down your fever. Yeah, so paracetamol can bring down your fever, can relieve a bit of your pain and things like that. Yeah, but I refuse to give you antibiotics. What do you think is going to happen?
Probably it's going to come back. It won't cure.
Yeah, it won't cure. Probably prolong, and maybe if it's long enough, you will recover, but you will be prolonged, and there may be some complications because the fever is actually only a symptom, right? So giving paracetamol is treating that symptoms and that fever.
Means tell me to cool down.
Yes, that's right. But the root cause is the bacterial infection. So how do we deal with the bacterial infection? We need antibiotics. Antibiotics means the bacteria. So you need antibiotics to treat the root cause of this particular problem. So just giving paracetamol alone is not enough. You need that antibiotics. I'm not saying giving paracetamol is wrong. You still need that, of course. But more importantly, to deal with the root cause, you need the antibiotics.
Okay. So that means having medications is only playing around with the symptoms, not really treating the root cause.
Having paracetamol, antibiotics is also medication. Yeah. So you need both actually. Yeah, but more importantly, you need the antibiotics more than the paracetamol.
So talking about diabetes, what seems to be the root cause of type 2 diabetes?
All right. So as I mentioned just now, when it comes to type 2 diabetes, the first thing that comes to everybody's mind is, type 2 diabetes is high blood sugar means it's type 2 diabetes. Okay, so that's the general perception about it. But the high blood sugar, it was never the root cause. Yeah, because high blood sugar is also a symptom of type 1 diabetes. is also similar. So the problem with the current treatment is, most of the treatment is that, the oral medications and then the insulin or even all sorts of supplements, those herbal, so-called herbal medications, they only play with these symptoms. So they always say that, oh, you take this, it will lower your blood sugar. Yeah, which is true. Anyone who have tried taking medications before or they take insulin, they notice that their blood sugar drop. But the problem is, that's not the root cause. So the root cause of type 2 diabetes is insulin resistance. Yeah. So while these two words may sound a bit complicated, let me break it down and do a bit of explanation. To understand insulin resistance, let's understand alcohol resistance. So what is alcohol resistance? Alcohol resistance is when someone start to drink. So of course, initially 2 cans, you can get someone drunk. So like me, I'm not an alcoholic. I don't like alcohol. Maybe 1 can is enough to basically keep me off. Okay, so let's say 2 cans initially, but over time, if the person keep drinking and drinking, over time that 2 cans won't do anything.
Yeah.
He needs more, right? Now he probably needs 3, 4, and it just keep going higher and higher. Okay, let's say now I'm the alcoholic and Ian, you're the doctor. So I come to you, Dr. Ian. I can't seem to get drunk with 4 cans of beer. Can you help me? Okay, let's say there are 2 options lah. Option 1, you're gonna tell me, oh Andrew, just drink more lah. Now 4 cans you cannot get drunk, right? Drink 5 and you'll be drunk and
push your
problem solved. Yes, just go more. Or you will tell me that, I think you probably need to slow down on your alcohol consumption. Which one would you tell me?
Okay, drink more. I'm the evil type of doctor.
You're the evil doctor, right? Yeah, drink more, yes. But of course, we know that it's supposed to reduce the consumption because too much alcohol causes alcohol resistance. Therefore, you need lesser of it to treat that alcohol resistance. So now back to type 2 diabetes, insulin resistance. Why is there insulin resistance to begin with? It's because you have too much insulin to begin with. That's why you have insulin resistance. What happens is when you start giving medications to the patient, many of the medication is supposed to stimulate the pancreas to release more insulin. Yes, it lowers the blood sugar, but the insulin resistance is getting worse. And then over time, the medication doesn't work. So doctors start to prescribe insulin to this patient. Of course, you have more and more insulin. Over time, the insulin resistance becomes worse and worse. So prescribing medications, insulin or supplements to a type 2 diabetes is as good as asking an alcoholic, drink more alcohol. That's exactly what's happening. Yes, on paper you're solving the problem. The alcoholic somehow still got drunk and somehow the problem of the day got solved. But over time it's getting worse.
Yeah.
The same when it comes to type 2 diabetes.
Yeah. That's why taking more medications doesn't necessarily help you to overcome your diabetes issues.
Correct. So on paper, yes, your blood sugar is well controlled and all. Yeah, of course it's true. But deep down, the patient is getting worse. That's why they still suffer from complications. This is the problem with the common management of diabetes when they give just medications, insulin, or even supplements to the patient.
Based on what you said, right, doctor, is that why most of the doctors, they cannot reverse diabetes?
Yes, exactly right. Because since high blood sugar is only a symptom, and the medications, the insulin and supplements only deal with the symptoms, that's why most doctors can't reverse.
It's just giving you more and more medications.
Exactly. So the way to treat insulin resistance, just like how we treat alcohol resistance, you need lesser of it. You need lesser of the alcohol. So in this case, you need lesser insulin. Alright, we already have too much insulin in our body. So now we need lesser of it. How do we bring down the insulin level? Okay, so we need to understand what stimulates the insulin to be released from our pancreas. Right. So the most important one, of course, is sugar. Yeah, it's the glucose, it's the carbohydrate. So I simplify it as sugar. Alright, so when we eat food that contains sugar, the insulin will be released. And too much insulin will cause insulin resistance. And so you look at the way that we are eating nowadays. Small, frequent meals. And what are the regular food that we are taking now? Give me some.
Rice,
Yes, right.
bread,
Bread.
noodles,
Noodles. Wow.
even roti canai.
Correct. Roti canai. Some perceive oats as very healthy. They take oats in the morning.
Yep.
And then many will take fruits. We're eating non-stop. Like we eat like 6 meals a day, right?
Yeah. Breakfast.
Breakfast,
After that, it's a tea.
morning
maybe.
tea, yes. Then
Lunch.
lunch,
Afternoon
then
tea.
yes.
Dinner.
Dinner,
Then
supper.
supper.
So can you imagine you keep putting all these sugary things inside, which is what you mentioned just now. It keeps stimulating the pancreas to release the insulin. So the insulin is always on the high side. Of course, it will lead to insulin resistance. So how do we deal with this now? You need lesser insulin. Of course, number one, you should stop taking all this high sugary food. That's where the low carb diet come into the picture. Other than low carb, the other very effective method is, of course, intermittent fasting. The logic is simple, right? You don't eat. Obviously, there's nothing to stimulate the pancreas to release insulin. Therefore, the insulin resistance will get better over time. So it's as simple as that. So it's these two methodology that we apply to treat the root cause of diabetes and therefore reversing it altogether.
But it seems like a very logical thing after you have explained, right? But
It's logical.
why still the doctors won't do it? They still give you tons of medicines to consume.
Okay, I think first of all, you notice that the methodology I mentioned just now is all about the diet. I mean, for me, like I also graduated from medical school myself, right? We hardly learn anything on this, like because we're not nutritionists, we're not dietitians, so we know very little about this. So we can't really blame them because they don't have the knowledge to begin with. For me, I really dive deep into it. I go for courses, you know. In fact, two years ago in 2023, I flew all the way to US to attend a low carb conference just to learn and just to mingle around and network around with like-minded doctors, you know, who are passionate about helping patients to reverse diabetes.
How many people attended? Like, wow, low carb conference.
Oh, there were like 300 doctors, reversing diabetes doctors. So with so much of excitement, right? Can you imagine over here, I'm a bit lonely lah, right? That
In Malaysia, you are
Yeah.
one of the few, right?
there are definitely a few of us, but there are very few of us. I would say I'm pretty sure it's less than 10 lah. I would say, yeah, generally so that. So there's no knowledge to begin with, so we can't really blame them. And I think secondly, even when we have, even if a doctor has got the knowledge, right, they may not have the courage to share
Why not?
because this is going against the standard guidelines. You see, clinical practice guidelines generally only share with doctors how you step up the treatment. Okay, you start off with one medication, then
Not
the
enough,
second one.
tambah.
Yes,
Tambah.
then increase the dose. Then finally you go into insulin. So it's a step up method rather than step down. For us, we are very good in stepping down. We are very good in removing medication. We know exactly which one to drop first, how to drop, how much to drop. Of course, this is based on years of experience now that we have more than 2,000 patients. Yeah, so the second reason why most doctors don't want to reverse is lack of courage. The next one is no face.
No face.
I mean, I'm not sure if you agree or not. Doctors are generally quite egoistic. Like, you know,
Okay.
in a way, like,
Yeah.
like you know, people, some people.
Yeah, like, don't question me.
Correct.
Am I the doctor or are you the doctor?
Exactly. So can you imagine if a doctor has been telling the patient that all this while, right, for the past, depending on how many years they practice, 10, 20, 30 years, right, diabetes cannot be reversed. You have to be on lifelong medications. And then suddenly from nowhere, hey, diabetes can be reversed.
As if they are admitting that I was doing it wrong.
Yes, for the past, I mean, how many years, right? Yeah.
Oh.
So, not easy to overcome. Then the next one is time. Yeah. We need time to reverse diabetes. It's because in order to reverse diabetes, we need better education, not better medication.
Medication.
So when it comes to education takes time. Right? You cannot ask a kid to complete the entire primary school within 1 year.
Correct.
It needs 6 years. The best is, of course, 5 years. Last time we used to have that skipping, right? But you still need time. So when it comes to reversing diabetes, it's the same. You need to provide patients with the right education. You need to make sure that they are able to unlearn their past wrong knowledge and relearn the new knowledge. And all this takes time.
Yeah.
Problem is, I think most doctors don't have that luxury of time when they're seeing patients.
Yeah, it's like there are 50 in the line Right. And you have like only 10 minutes for each
Correct.
patient. How can
Yeah.
you like educate them and
Exactly.
pass on this knowledge?
Correct. In fact, 10 minutes is considered a luxury. I remember last time when I was practicing in the government clinic, right? I'm supposed to see 80 patients within 4 hours.
Wow, how is that possible?
Can you do that calculation?
My math is very bad.
80 within 4 hours. That means every hour I'm supposed to see 20 patients.
Mm.
60 minutes for 20 patients.
3 minutes each.
Right. What can I do? I
So
can't
that is
explain
the-
anything.
That is your KPI. You have to do it.
Yeah, especially if my colleague is on leave and whatever. I mean, nowadays it's even worse, right? I mean, especially if you go to the government clinics and hospital,
Hmm.
we all know that this problem is now brewing, in the government setting where a lot of doctors actually left the practice.
Mm.
So it makes it even worse. And of course, it's not getting any better in the private setting as well. So time is a factor, all right? And I think the last one is probably the worst reason because there's no money to be made.
Okay. Impacting the pocket.
Correct. I mean, can you imagine patients taking lifelong medications? Someone is selling it, right?
Mm.
Someone has to make money from it, right? So when we don't use any medication, there's no insulin, and I don't even recommend any supplements for that matter. And then when we're asking patients to do fasting means you're not eating anything. There's no money to be spent.
Yeah, in a way, it's like the doctor trying to cut their business off already
Correct.
by giving you the right tool to treat your diabetes. I'm like, okay, bye-bye, no more reoccurring business.
Correct. There's no more recurring, and there's a very sad reality in the medical world. A patient cured is a customer loss.
Oh, wow. Can you say that again? This is something that we need to be
In the
reminded.
medical world, a patient cured is a customer loss. And this is a very sad reality. It's true, right?
Yeah.
Once you're cured, like you say, there's no recurring one year. Like for my patients, once they learn they acquire the knowledge, they reverse their diabetes. That's it. Because there's no products involved.
So
I'm not selling any supplements. I'm not asking you to take these supplements for the rest of your life. No.
So it's sad to say, some doctors they perceive themselves as if they are businessmen, and people who come back to them very often is like long-term customers, and who would want to like throw away their long-term customers, right?
Yeah, but of course, to be fair, not all doctors are like this. There are still many good doctors around. Yeah, it's just the business model that doesn't support this way of managing diabetes. If you get the right business model, well, you can still help patients. And of course, we need to make money. I mean, this is not charity, right?
Correct.
Yeah, like doctors still need to feed their family and things like that. What? Yeah, but for me, we need to make money the right way. And the right way is truly to help patients
True.
and not making it worse for them.
True. When you say making money, also like I would assume a lot of doctors we may seem that they run their own business, they are their own entity and whatnot, but when they are opening up their clinics, right? They are also a tenant. They are renting it. They need to
Yes.
pay rents.
Yeah, of
If
course.
there's no customers, as
There are
no
no patients.
patients,
Yeah,
they would have lost also, right? So they
Yeah,
how to
correct.
balance it up with still earning the right money and giving the right treatment. I think that's a difficult thing to juggle. lah.
it's never easy. It's never easy. Yeah, but that's a different story altogether, lah. Yeah.
Okay, so there are so many truth bombs that Dr. Andrew has given us today. Any last words before we end the session, Dr. Andrew?
There is not a magic, all right? There's no magic involved in reversing diabetes. The key element, the key point is we are treating the root cause of it. That's it. It's not magic, it's not miracle, it's not that you have to pray to 10 gods or whatever. No, none of those. Yeah, we are here to keep things simple. We are not here to complicate anything. Yeah, because life is complicated enough. All right, so let's keep it simple. Remember, deal with the root cause and not the symptom.
Okay, so once again, thank you so much, Dr. Andrew, for joining us on this podcast. So feel free to click on the links below and check out our Health Talk online and offline. And also follow us on social media because Dr. Andrew will only review more of the truth bombs. And remember to follow us on the next episode where Dr. Andrew is going to be up here again, sharing with us more secrets regarding diabetes.
Thank you so much.
Thank you.